Hi, good morning to everyone. Thanks again for listening to this lecture about vascular access in pediatrics. A few of you might be wondering what's so unique about this topic and why would I talk about this? Vascular access in pediatrics is probably the most frustrating, time-consuming intervention for an anesthetist, particularly in small children. Not only that, for the child, it's a terrifying experience. So it's something which they definitely don't enjoy, and that's one intervention based on which they don't want to come to a hospital or see a doctor or a healthcare worker. So any injections is going to scare a child, not even in adults. It's quite difficult to get a needle in, but in child, I think it can be quite frightening for them. So we need to try and make this experience as smooth as possible. So in this lecture, what I would try and cover is different kinds of vascular access, starting with peripheral IV access, central venous access, PICC lines, intraosseous access, and arterial cannulation. So we all know that the basics indications for vascular access, it could be just for inducing a patient for anesthesia and surgery, or you could get a call from the ward saying that this child has got a difficult access, we need antibiotics for the next week, we need some kind of intravenous access for that. You could get called from the intensive care for a central line for a parenteral nutrition, or in an emergency where they find it difficult to get an access in the emergency room, you might get called. So how is it different from adult patients? One is, the main thing is they are uncooperative. So that's going to be difficult. Yeah, you need to cannulate a moving child, or you need to restrain a child and try and do it. So it's not a nice experience at all, is it? Coming to the anatomical reasons is they have a smaller diameter. They could have a lot of fat, subcutaneous fat in some children, so it can be more difficult to cannulate these children. And the veins, actually the diameter of the veins are small, and compared to an adult child, you may not feel them in small children, but you can see sort of a greenish tinge where the veins are situated. For the same reason that you need to, when you cannulate small children, gloves may be a hindrance to palpate the vein and cannulate them. So you might have to do it without gloves. Before you do a cannulation, you use skin disinfectants of various kinds. So what do you use in a hospital? So these are three different things which we could use. Some people also use povidone iodine, but in our hospital we have all these different makes.